Welcome to the Valaura Exchange, where leaders connect the dots between health, humanity, and performance. Each episode brings real conversations, fresh perspectives, and the insights shaping the future of how healthcare leaders understand and solve today's most pressing challenges.
Health plans have never invested more in member engagement, yet despite all of the outreach programs, digital tools, and communication strategies available today, underserved populations often remain the most difficult groups to reach and support effectively. A lot of organizations talk about engagement as a participation problem, but we're hearing that this may be more under access, trust, and understanding the way that the unique needs of the communities that they're trying to serve. For those of you joining us for the first time, my name is Teresa Connolly, and I'm the Director of Clinical Business Development here at Valaura Health. And to help us unpack this discussion today, we're joined by Bryant Harvin from the National Alliance on Ending Health Disparities. Bryant, very glad to have you here today. Before we dive into all of the questions, though, would you mind giving our audience a brief overview of your background and also the work that you're leading at your organization?
Sure. Thank you, Teresa. My name is Bryant. I am the founder and chief executive officer of the National Alliance on Ending Health Disparities, and we are a nonprofit organization that exists to empower those through research, education, and advocacy in order to eliminate health disparities and advance health equity in all communities. And so my background is primarily in nonprofit work throughout a variety of health adjacent fields like pharmacy, allied health, and also counseling and behavioral health. And I would say that this organization was found on the lived experience not only of myself, but also my sister, who was a chronic and rare condition patient and has, sort of fought her way through some of the barriers that were thrown at her. And this organization is mostly founded in her honor through her journey.
That's really special. Thank you for sharing that context behind your company, because I know there's a lot of meaning behind it. So thank you for sharing that with our audience. And now I hope we can dig into some of the things that your company helps serve and help support within the community with our first question. When health plans talk about engagement gaps in underserved populations, how often is that really an access or a trust issue, in your opinion?
As it relates to health plans, I think that it's coming from the lack of engagement is coming from their end. And I say that because, these populations want to be served, they want to have resources, they want to feel empowered in their care journeys, but there is that lack of trust from healthcare plans overall and fear, I would also add to that.
Absolutely. And building off of that, there's a lot of discussion around the community engagement, but it can mean different things to different organizations. Can you walk us through what effective community engagement actually looks like in practice?
Yes. So I would say working with patient advocacy organizations, hearing stories and trying to empower those individuals that you're working with to use their stories to advocate for change and for better change. And, most people can't afford like costly procedures and care. And so, especially care that's medically necessary. And so really just working with them to empower them and let them know that their lived experience means something. And that I find that usually helps us with the work that we do, especially because we're very patient focused. And, our organization sort of started based off the lived experience.
Yeah, and that's actually why I really value what you've put into your organization and the work and the community that you serve, because like you said, you have that experience firsthand. And I've seen it myself on the health plan side with prior roles. Like you mentioned, just making sure that patients feel safe, but also they understand that they can vouch for themselves, like speaking up against those folks that maybe it's not that they don't want to help serve them, they just maybe don't know the best way to do it. So empowering them, like you said, to give them the tools that they need to advocate for that, that's huge. So kind of looking into some more yeah, absolutely. So one of the themes that we do hear frequently, though, is that organizations are trying to improve engagement. They're trying to add more outreach because they think that maybe that's the way to tackle it. But true access really may require something deeper, like something that your organization is helping with. So From your perspective, what does it mean to truly design for access rather than simply layering on outreach on top of like an existing system that like a health plan or any organization really has in place?
Yeah, so I think the first part of that is that these systems were not designed for the underserved populations and medically disadvantaged. And so we have to first, redesign those systems and consider how to meet patients and, whether it's rural areas, urban areas, different settings, meet these individuals where they are. A lot of them can't travel, they can't afford to travel and things like that. And so to me, it's simple as working with a nonprofit organization or a patient advocacy organization, simple as us, because what I've found, at least since being in this role, is that the patients would trust us a little bit more because we are more aware of their needs and sort of serving their communities on a more intimate basis. And so they can, help to partner with us in some of these engagement efforts. They can also fund specific programs and outreach initiatives that are going on. And, that's just not only for us, but any sort of patient focused organization across this country.
Yeah, and I'm glad you brought up the trust piece because that was going to be one of my next questions as well. And given that you have this experience and with your organization, how do you actually build and sustain trust at scale with communities?
Yeah, so I think a lot of it has to do, and these are kind of derived from our three core pillars of our mission, which is research, education, and advocacy. And so it takes the research to figure out, what the problem is, how long it's been going on, how to effectively solve it, and then educating those individuals, whether that's, webinars or providing tools and resources that, they can continually read up on or take on demand in their time. And so one thing that we really do is we solicit feedback for our educational programs. Like we just did a webinar last month on mental health in men. And so we analyze the problems that are coming about and try to find ways to help solve those problems. And then advocacy, things wouldn't be where they are, or we wouldn't get to a better place unless there's change. And so advocating for change, alongside of those individuals, independently of those individuals, so they can see the organization is helping to work for them and fighting for what they need. And in the background, they feel like they have someone on their sides, because I will say that typically the average patient doesn't think that the health plan is on their side. So yeah.
No, yeah. It's sad, but it is true. You're right. And it sounds like you take the time with your organization to actually research, but also connect, like make those connections with the community, which is huge because the trust piece is really where it starts, right? So I think that's one big takeaway that anyone in the audience could have is working on building that trust, but also making sure you have the foundation with research, like you said, like knowing what you need to target and how you need to speak and educate those that you're looking to empower. So that's huge. Thank you for going over that with us. And I guess also, like, what would you say distinguishes engagement efforts that really lead to improved health outcomes? Like, even if you could speak to, like, how you just talked about your event that you held, for example, like, are there things now that you've had that session with your that group of folks about the mental health component that you're now going to build on with your community or your organization, or just any examples that you could give that kind of lead to those improved health outcomes we're looking to achieve?
Yeah, so even though most of our webinars and things like that, as an example, aren't like continuing education focused, they're generally open to everyone. So we normally have learning objectives, and we often do pre and post assessments to gauge confidence on, for example, on how one would take the tools that they learn to improve or expand knowledge to someone else on mental health. And so we really sort of look at that data and we try to make a determination like, okay, are the people who have taken this program really learning this material, and are they actually going to use this information that they learn to implement change, within themselves or within family, friends, other individuals, to really let them know what they've learned and how it can or will impact them. And so that's one way that we see trying to sort of measure what possible outcomes will look like from the various individuals that we touch at any given point with our programs.
I like that. I like the pre and post piece too, because like you said, it's kind of learning how where the growth is going and if it's catching on. And then like you could also curtail or like I guess adjust your educational formatting in the future then based on like what you learned from the audience too. And also just seeing like basically who's coming back and like returning to learn more is probably a good indicator as well, like the retention piece and growth, right? Like more audience members like viewing your content and wanting to educate themselves on these important topics. So that's no, that's awesome. I'm glad that you're doing that, and I would definitely agree that's a very important and great way to assess all of those things. So I guess like with things going on with CMS, the government, honestly, it's not just for Medicare plans, and it's not even just for health plans. I think just for organizations dealing with healthcare in general, there's going to be and is a greater focus on populations like who you serve with higher needs. Like basically, maybe they're dual eligible, they could have disabilities, lower income, could be other barriers that they're facing. From your perspective, since you guys are navigating this already, how should organizations think differently about engaging and supporting these groups? Because they have novel situations. Is it kind of a mix between, like you mentioned, the webinars and then some on the ground work, or any other tactics that you would want to share for like how to handle these very special populations that need more care and more guidance, if you will?
Yeah, I definitely think it would take working more hands-on with the organizations that are within these communities. Like, as an example, here in Virginia, at least, we have the Virginia Rural Health Association, which serves all Virginians in rural health areas. And so, like, really working with them to identify how they could help support them to reach more individuals in these areas. And so I think it's working with these associations and other community-based organizations to sort of help more, more so getting the care and support to those people who are affected by these things in those specific areas. And so I think, that's definitely probably the best approach, but I also think a secondary approach, kind of like I mentioned, is definitely the education, whether that's in person, sharing stories, um, or just figuring out the best ways to serve on their own independently as a company or organization through surveys or mailings or just displaying certain QR codes everywhere with just random educational facts and resources that could also be helpful.
I like that. It sounds like it's a lot of like making sure you're personalizing the care and also going to the experts so that they can help maybe educate you and make you be an extension of their team in a sense with, let's say, a health plan that wants to engage or help a community that's harder to reach. You might need to tap into those resources, like you said,
Hmm.
and kind of learn like the nuances of what's the best way to get a hold of this type of population and what is the best way to connect with them and like get through to like actually make that message clear and make sense to them too. So no, I completely agree. I think that's something that it's not that they don't want to do, but it's probably just making sure that they're aware that's a really good opportunity. Like look at your credible organizations around and connect with them because they have a lot to teach you. So that's awesome. Thank you for that information. Another challenge that
Yeah.
we're hearing is translating community insight into organizational action. So there's a lot of valuable information that's being gathered on the ground. It just doesn't always make its way into strategy and operations. So where do you see the biggest gaps between what's happening in the communities and how organizations are operationalizing engagement? Would you say it's kind of what you already spoke to, like just making sure they know of maybe the right credible organizations to tap into, or is there other gaps that you would say you
Yeah.
would call out?
Yes, I would also add to that and say I think what makes this a little bit difficult on like the health plan side is usually these patients are not really looked at as independent people. They're sort of grouped together as and being more generalized when everyone has a unique story, a unique background, unique challenges. And so you really have to sort of separate these areas and in the actual person so that this won't sort of skew their information or
Mhm.
I just feel like they're skewing their own information by generalizing a lot of people and they're not getting the data that they need from what they've collected. And so therefore they're not using it in the best ways that they can.
No, that's fair. So kind of like instead of doing these broad outreach campaigns or making it like almost like you said generalized, trying to really hone in on well, first of all, who is it that we're looking to target, but then learning enough about them to make it specialized, like making it a more one-on-one type of conversation than feeling like, hey, you're just someone else that's in this group of people that I'm just trying to reach to close a gap or whatever it may be. I completely agree with that. It's almost like the persona piece, like learning like what they're about, their story, their origin, but then also like how do they want to be communicated with by the health plan? Do they want mailings? Do they want outreach? Do they want to be in person? Like learning all of that about them if they can, because they do have capabilities to do so. It just might take a little bit more effort, but it's worth it in the end, because it's probably the most rewarding type of work you can do if you can connect with someone and really get that relationship. So no, I agree with everything that you said. It's been very interesting because like I come from the health plan side as well. And even at Valaura, we handle this too, where we have patients that they do need that extra support, and you have to kind of figure out like what is it that we can do for Mr. Smith that is different from another person, so that we can actually get the action that's needed, but to help them so that we can actually benefit their health. So it resonates a lot with me. So thank you for sharing that insight. And I think I have just like one more broad question to ask you that I like to ask anyone that joins our podcast, because it's just interesting to hear. Where do you think the healthcare industry may be going when it comes to, where do you think the healthcare industry may be unintentionally making disparities worse, even while trying to improve engagement? Like, is there somewhere you could pinpoint that they could almost learn from themselves of what you've seen in the industry in that aspect?
This will probably be my answer for every. I probably repeated this in a way, some shape or form throughout this conversation, but I would say really using the patient's stories and their individual charts. Because a lot of the times, and I hate to say this, but this is why most health plans are disliked, because patients feel that they are just another number to them. They feel that, especially as it relates to like prior authorizations and coverage of medications, like that can still be expensive, with or without insurance. And so I would say that they should really look at those patient stories and sort of treating them with a little bit more caution versus like textbook definitions of things and their diagnosis. I hope I made sense there.
Yeah, and I think that does make sense. And I think also, like, I'm also hearing that maybe it's worth making sure you have some focus groups or some way of, if you're looking to help serve a certain community or population, actually, like you said, hearing their story, like literally listening to them instead of just developing a protocol is kind of what I was hearing. And then the persona piece that we talked about before too, even though it's been repeated, I think it's an important thing to note for healthcare leaders that, like you said, everyone has their own story, their own likings, their own preferences. It's important to learn them. If you want them to be a member of your plan and you want to operate and work and serve them, you need to know your audience. So I think that makes perfect sense. And I think maybe a focus group or something where they can hear their actual patient population out would be beneficial too, kind of adding to what you're saying, since it would actually get their story out for real if they're listening to them, or even just testimonials, like you said too. So no, I think that makes a lot of sense. It's really just making it a more personalized journey. And I think that is where healthcare should be heading if it's not already. Because I know that we think that's very important at our company too, just making sure that a person feels heard and they're supported in the way that they want to. Maybe they don't want to talk just about their medication. They want to offload a little bit about what happened in their day, for example. And if you hear them out, it helps them open up more and be more receptive to your outreach. So I've been there as a caller, and I've been like, like you said, there's a list of patients you got to get a hold of and outreach to. But if you don't make it personable, it definitely doesn't make the conversation better. It makes it harder. So no, I completely agree with everything you said. And I also think that it's something that health plan leaders should take a little closer look to when they have the ability to, because they probably will see a lot of reward in the long run with member retention, also like member experience, improving that. Because those are all things that matter to the plan, but also then give back to the patient. So that's perfect. Thank you. And I just have one last question for you because I know I've asked you a lot. Just making sure, is there one thing for any healthcare leader out there that you would suggest they should build or rethink before investing further in engagement strategies for underserved populations? And it can be something you've mentioned before, by the way, just whatever your like punchline, if you would be that they should think about before they just go out and do outreach for a patient population.
Yeah, I think it's definitely working with patient advocacy organizations, something I said, time and time again earlier, but these individuals who are part of these organizations, they work closely with their organization of choice. They also, they join these organizations because they have a story to tell. They are battling with certain conditions and they just, they're looking to obtain better care, maybe not only for themselves, but for family members and for various other people. And with that would come some data that could possibly be shared with health plans. And so it'll also demonstrate that they're really working to try to close gaps, by working with, these patient advocacy organizations. And it also may build some trust with some of these patient populations because they'll see that they're not directly trying to reach out to them, but more so they're reaching out to an organization that they trust themselves, that they're, part of in some way, shape, or form, whether it's due to family or an illness of their own or something like that. And so I think there's value in them working with patient advocacy organizations a little bit more, just because there's already that, established level of trust, and organizations would be happy to work with them to sort of bridge those gaps.
I like that. And it's okay if you don't know. I'm just genuinely curious for people listening. Is there a way to find a central repository of all the different organizations that they could lean on in their community? Like, is there anything that's maintained, or is that not as easy as it sounds to be able to find the places within their state, if you will, that they could look to?
Yeah, so I would say there's a mix of like there's a mix of national and state level organizations.
Mm-hmm.
I will say I'm only familiar with NORD's list. I believe it's the National Organization for Rare Disorders.
Okay.
They maintain a list for at least for like rare disease patient advocacy organizations. And it's probably not all of them, but I know they do maintain like an extensive list. And so, at least for those suffering from rare disorders and diseases, they can
Mm-hmm.
turn to NORD and find organizations in their state or other national organizations that they can be a part of. I'm just not sure of like chronic disease
Yeah.
organizations, but definitely for rare disease organizations, there is like a central place through NORD.
Okay. Well, that's fine. No, I think it's important. So, like, basically, they have to do their homework, research a little bit about what's out there and like what's supporting, like you said, the state level or even national level for whatever it is that they're looking to achieve, too. So, it's going to be a use case. It's dependent on the organization as well. But that's very helpful to know for the rare diseases that there is a list maintained. And I would imagine there would be, like you said, for chronic conditions as well. Just need to find the right resources at that time. But well, this was very informative. I think this is very helpful for health plan leaders, but also healthcare organizations just in general, to just hear more about someone who has that expertise, that has that inside lens about this information. So regarding the end of this conversation, I first wanted to see if you had any links that you wanted to share about your organization that you would want to point the users to after this audience, or after this is taped, I'm sorry, so that way they can be directed to like good resources on your end for your organization. Would it be your YouTube or your LinkedIn site? Do you have a website in general? We can also add it inside of the podcast so that the team can hear that afterwards or see it afterwards.
Yeah, one could visit our website at www.naehd.org. We also are on LinkedIn. We're on Instagram, Facebook as well. Everything should be at NAEHD.
Okay.
So should be able to easily find us there and engage with us. We do have some upcoming things going on, so it would be great if anyone could join our newsletter. That information sort of gets pushed out every month to our general public newsletter. And then we're actually switching from bi-weekly to monthly for our member newsletter as well.
Okay.
And so lots more information is housed there too. But yeah, we're happy to invite anyone to look on our website. We do have various resources like a Health Disparities 101 page. You can also meet our board of directors and learn more about them and education that's upcoming and plenty of other things that are in the works.
Well, perfect. I mean, if someone's looking for an organization to partner with, I'd like to say that this is a great opportunity for them to research you more. And like you said, maybe they can get into the newsletter or learn just more about what you serve. And maybe that could be one of their ins to helping with this overall strategy, too, that they're trying to resolve when it comes to reaching more folks, especially in the underserved space. So that's all very helpful. And we at Valaura also value this a lot. Again, we work on high-risk populations that do need other support than just a simple phone call to solve a gap. So really appreciate you joining us today and sharing your insight on this information and your organization. You've built an awesome foundation and a community, and really hope that this can get out to a lot of healthcare viewers and able to make a change in our overall population health, which is huge. So thank you again, Bryant, for joining us today. And we'll hopefully be able to continue to show all of these different topics to our healthcare leaders and make a change in the world. So thank you very much, and I hope you have a great day.
Thank you. Same to you.
Awesome.